How to correctly take impressions for Invisalign treatment. Only Invisalign trays are to be used when taking impressions for Invisalign, as they have a very specific notch in the handle of the tray, which is utilised in the scanning process. The trays come in 3 sizes: small, medium and large. 90% of cases will normally fit into the medium tray. Only PVS impression material can be used when taking Invisalign impressions. Aligner Consulting recommends using the PVS impression material you are already accustomed to ensure ease of use. When taking an impression, always stand behind the patient for correct postural approach. Use your strong hand to insert the tray to ensure that you can use the necessary force required. Pull the cheek out of the way and rotate the impression tray into the mouth. Ensure to seat the impression tray over the back teeth first, and then extend to include the front teeth. Ensure uniform pressure is applied, using 2 fingers evenly spread on either side of the tray whilst the heavy body material sets. Remove the tray when the material is almost set, gently rocking from side to side to ensure there is enough space created between the heavy body material and the teeth. This allows for the light body material to flow properly. The impression should capture at least 2 mm of the gum beyond the tooth, and detail of the occlusal surface and gum line. It is normal for the blue tray to be partially visible through the heavy bodied material. If you prefer, you can use a spacer on top of the hard bodied impression. This is placed in the mouth as normal. The purpose of the spacer is to create enough room in the impression to allow the addition of the light-bodied material. When the material has set, remove the impression and then the separator is removed. Next, fill the tray with the light-bodied material and repeat the insertion procedure. Ensure to use the same hand and body position, rotating the tray into the mouth by pulling the cheek out of the way on the opposite side. As before, the tray is seated over the back teeth first and then extended over the front teeth. This prevents too much light-bodied material extending down the patient's soft palate. Again, uniform pressure is applied throughout, using 2 fingers evenly spread on either side of the tray. This technique helps to ensure an even spread of light-bodied material and consequently an excellent impression. It is useful to extrude a little of the light-bodied material onto the back of your glove in order to easily check when it has set. This allows you to keep the necessary pressure applied at all times before removing the tray. Once the light-bodied material is set, remove the impression tray. Having removed the tray, check the gingival margins for tears or blows, once more ensuring that 2 mm of gum beyond the tooth has been captured. A good impression will show all the occlusal detail very clearly, including the palatal and buccal gum margins. No blows or drags are visible and no shine through from the tray. It is most important to capture the area near the gum line of the upper incisors. If not accurate, it can affect the aesthetics of the aligner fit. For ideal aesthetics, the aligner should finish at the gum line, not over or under it. Though an impression of the whole tooth is preferable, capturing the mesial buccal cusp of the upper 8 is enough for Invisalign. As long as the mesial part of the occlusal surface is captured, the aligner can be extended over the back tooth to prevent it from over-erupting. Sometimes use of a larger tray would allow more support for the impression material, or alternatively, modified wax could be used to create a bespoke, special tray for the area. This example is adequate as the mesial part of the occlusal surface of the tooth are covered, enough to prevent it from over-erupting. To summarise, an ideal impression should show all occlusal detail, no drags or blows, no shine through from the tray, 2 mm of the gum above the crown, both buccally and lingually, and cover 30% of the occlusal surface of the upper 8s.